Hello, everyone. Welcome to the November monthly meeting for youth organization. Today we'll be presenting, and we're pleased to have Dr. Rachel Kowalsky with us today. Dr. Kowalsky is an associate professor of clinical pediatrics and emergency medicine at Weill Cornell Medical College, as well as an assistant attending pediatrician at New York Presbyterian. Dr. Kowalsky has earned her MD and MPH from Tufts University and completed her pediatrics residency at New York Presbyterian, followed by a fellowship in pediatric emergency medicine at NYU. Dr. Kowalsky is passionate about integrating clinical care with medical humanities, running narrative medicine workshops, and teaching medical students to foster empathy in healthcare. She has also published extensively on topics like pediatric emergency care and healthcare disparities, and we're honored to have her with us here to share some insights with us.
Hi, thank you for that lovely introduction. It's so nice to be with you today. And I'm just gonna share my slides. Okay. Today we're going to talk about my journey into medicine, how I got here, what it's like. So this is where I work, Weill Cornell Medical Center, which is part of the New York Presbyterian Hospital System. And fun fact, Salah Haldine's sister also works there too, so we get to work together. So how does a person become a doctor? So I think most of the people who are watching right now are in high school. After high school, you do a 4-year college program and then 4 years of medical school. After medical school, you're a doctor, but you're not ready to hang a shingle and practice on your own. You do a residency, which specializes you further into the area that you're most interested in. So, for example, you could specialize in internal medicine, pediatrics, which is what I did, psychiatry, OBGYN, neurology. So there are different specialties that you can do. And then from there, you can either finish and practice that specialty. So, like, become a pediatrician or a general internist, or you can do a fellowship and specialize even further. So for me, I did a fellowship in children's emergency medicine. So after my residency, which was 3 years of peds, I went on to do 3 years of just pediatric emergencies. And then I was ready to start my career. So I went to a public high school in Hamden, Connecticut. Whatever type of high school you're coming from, medicine is an option. So don't let anybody tell you I have to have gone to a private school, and don't let anyone tell you, oh, if you went to a private school, it's so competitive. You're never going to be able to make yourself stand out. You are where you are. Don't let that panic you. There are many roads to medicine. After that, I did 4 years of college at Brown University in Providence, Rhode Island. And I was a literature major there. So that's becoming more and more common in incoming medical school classes is to have majored in something besides biology. So don't feel like you have to be a science major. If literature is your thing, or philosophy or the classics, that's okay too. I did a post-bac program, which some people do if they haven't finished all of the pre-medical classes before they want to apply to medical school. So you need to take a specified amount of math, chemistry, organic chemistry, and physics before you can apply. And so I had taken lots of literature classes and not enough science classes. So I went on and took a post-bac program, which was at the Tufts undergrad campus. And from there, I went to Tufts Medical School to a 4-year program. And my program, like some others, but not all, lets you get 2 degrees at the same time. So I did an MD and an MPH in those 4 years. My husband, who I met in medical school, did an MD and a master's in business administration. So it's possible to get a degree besides your MD. Some people do MD, PhD programs. After that, I did my residency at Columbia Presbyterian, which is in Washington Heights, New York City. And from there, I did my fellowship in pediatric emergency medicine at NYU. And finally, in 2010, landed at my current employment as a newly minted pediatric ER doctor, and I've been there 14 years now. Okay, so to get into medical school, you need to have some amount of service, like volunteer work and research. That's something that they're going to look for on your application. And so, as I was putting this talk together, I was thinking, I really focused on Guatemala. And I guess I'm Guatemalan. My dad came here from Guatemala when he was young and built a life and a career in medicine here. But I'm very connected to my roots. And so I worked with a mobile clinic doing service in Guatemala with a mentor from Brown while I was an undergrad. And then I did a research project on water quality in the rural areas of Guatemala, also with a mentor at Brown. Later, when I was in post-bac, I did a project on exposure to pesticides. And even later, when I was getting my master's in public health, I did my field work on access to cardiac surgery for children who come from rural areas of Guatemala. And for that, I had a mentor at Boston Children's. And one thing I'll say, because you're probably all thinking about your research projects right now, is that it's kind of a balance between what you have the opportunity to jump onto, because as a high school student, it's hard to say, like, this is what I love. Let me go find some research in this subject. It's like you kind of have to just take the opportunities where they crop up. Um, but do your best to do something you're interested in because it will really show. You're going to write about this for your medical school admissions essay. You're going to talk about it in your interviews, and it's really going to show if you're truly inspired and excited by something versus like, I worked in this lab because it's all I could get. Um, so do your best to balance that sort of opportunity versus what you're interested in. So, what made me go into medicine? I was a literature person. I love to read and write. But what I kind of learned is that you can appreciate the the humanities and the sort of vulnerability of being a person in a human body and also like science. And actually, those things go together really well. I have always liked helping people, and I still do. That feeling of making somebody feel better because of something you knew or a skill that you had is amazing. I really like problem solving. I like to sit and think through, like, okay, this child has a fever and a rash. What could it be? And like making the list and narrowing it down based on tests and asking more questions of the family. So if you like problem solving, medicine is a good place for you. I'm a curious person. I like school. I like to learn. That's why, part of why I did my MD and my MPH at the same time. Now I'm doing some coursework at Columbia in the health humanities, and I think I'll be in class forever because I just really like to learn. And I was inspired by role models. So my dad was a child psychiatrist. My uncle, who lived in Guatemala, was a child neurologist, and I have cousins in medicine also on both sides of my family. That being said, you don't have to have a doctor in your family to be a doctor. So don't worry if you're not sitting down to meals with a doctor, in your family every night or even at family occasions. If you're the first doctor in your family, that's fine too. So this is just my story, but it's not the one story. So when I taught, so I work in the ER and I work overnight. And it's really interesting when you work with people overnight, you talk a lot more and get to know them on a very human level. And so this is what I hear from trainees, meaning like medical students and residents, and my friends and colleagues about why they went into medicine. They like helping others. They like the intellectual challenge. It's great job security. You will probably always have a job if you go into medicine. Financial stability. So you may not be, one of the uber wealthy traveling in your private jet and having your yacht. Maybe you will be, but you will always be stable financially. You can go into lots of different specialties. So I do children's emergency medicine. My husband does orthopedics and sports medicine. Our practices couldn't be more different, but we went to the same medical school and we took all the same classes. There's so many things you can do with that degree. You're always learning. You always are a respected member of your community, whether it's your neighborhood, your children's school, your faith-based community. Um, because you're a doctor who's given yourself over to study and to taking care of other people, that does come with some level of respect. You have a sense of purpose, taking care of other people. There's lots of opportunities around the world. For me, Guatemala's, my place that I like to go on the globe, but you might have a place that you care about and where you have roots, and would like to do work. Um, and being part of a team is, if you're a team person, it's a lot of fun. You work with some really smart, people around you. The doctors I work with and the trainees, what are they like? They're empathic. Not every single doctor. I'm sure everyone can think of like, well, I met a doctor that wasn't nice at all. Totally true. Doctors are people, and some of them are not empathic, but it's a pretty generalized characteristic. Communication skills, we think a lot about and now train in how to talk to other people about things they're anxious about or things that are uncertain, like what will happen next in their illness. Um, they're people with problem solving skills. They're people who are adaptable. So during the pandemic, doctors switched roles pretty quickly. We had urologists working with us, in the emergency department, and psychiatrists helping triage people with COVID over the telephone. So being able to adapt to different situations, ethical decision making, attention to detail, resilience, team players, people who like to learn, and often people with leadership skills. So let me tell you about my specific job. So I work in the pediatric ER at Weill Cornell Medicine. That means that my patients are all under 21 years of age. I see them for injuries like a fall off the bed or a skiing injury or a sports injury. I see them for illnesses, for example, influenza, COVID, stomach bugs. We take care of children who are both acutely ill, meaning they got sick that day or that week, and children who are chronically ill, meaning they have a diagnosis that's going to be with them for some time or maybe for their whole lives. And we also see behavioral health emergencies, which means individuals who are having thoughts of self-harm or are very anxious. We see them too when they're in crisis in the emergency room, and we're open 24/7. So we're a great safety net for people who are having a behavioral health challenge. So, ER docs work all hours. And so I'll tell you about my particular overnight shift last night. I saw a lot of croup in all ages, because it's the fall, it's respiratory season, and oftentimes a child goes to bed feeling fine and then wakes up with cough and trouble breathing. That is croup. And it gets better with just a dose of steroids and sometimes an inhaled medicine called racemic epinephrine. So lots of children with croup, a child with an asthma exacerbation, a child who fell out of bed and had a laceration on their scalp. So a lot of the time we'll close those with staples, but this particular child didn't need that. Um, Abdominal pain, lots of belly pain in the pediatric ER. One of my patients last night had appendicitis, and that's where medicine can be very collaborative because then you're consulting with the surgeons. They're helping decide what types of imaging studies to get so they can plan their operation. And eventually you're handing that child off to the surgeons because they're going to do the operation. And I also unfortunately saw a case of drug facilitated assault, which is something important to think about when you go into pediatrics, is that sometimes bad things happen to your patients and you're a witness to that. And you can make a huge difference in helping take care of that person and helping make them feel better. So again, I emphasize if you go into emergency medicine, you'll work overnights, weekends, and holidays. So while it's still the specialty that I would pick over and over because it's so interesting um, and so fulfilling, it's still something to think about that at night when your family's all together, you're driving away from them to go to the hospital. What else do I do at my job? So I do a lot of teaching because I work at an academic medical center. So I teach medical students, I teach pediatric residents and emergency medicine residents, and I teach fellows. So on the left-hand side is myself and one of the medical students. She did a poster on one of our research projects, which is related to asylum medicine, and she presented it at the New York Academy of Medicine. And then on the right-hand side is a summer project, a summer research assistantship that I participate in teaching called the Diversified Summer Apprenticeship, and we're learning resuscitation skills on a mannequin. I also do research, so my research interests are health equity and the health humanities. So my last three publications, one was on skin cancer images and the over-representation of white skin on the images that you find when you just search skin cancer. In other words, not lots of illustrations with dark skin on the internet, which is something that we need to do better at. Also the asylum medicine paper and a paper on racial disparities in atopic dermatitis and food allergy. This is my group. So even though I drive away from my family on nights and weekends and holidays, I come to this second family, and these are really the heartbeat of my work. So you see my boss, Dr. Platt, kind of in the center there, and all of us arranged around her. This is a dinner that we went to because we just like to explore different restaurants in the city. And one of us knows all of the restaurants really well. And so he always picks the place. And that was the Thai diner last week. So work-life balance. So I already said I met my husband in medical school. So he knew what he was getting into. But it's really important as you go along your career, you're going to make lots of sacrifices to get to the next step each time. But remember, you get one life. And so carve out that time for the people that you care about. So these are all my favorites. Well, on the left, you've got our bearded dragon, who's the newest addition to our family. All my college roommates are there in that picture on the beach. We meet up as often as we can, once or twice a year. The next picture is my family at Halloween. We were from the Thriller video. I'm not sure if you can tell that I'm Michael Jackson. And the fourth picture there is our two dogs. So I make sure that I get time with the people that I care about. When I think about what makes good care, especially in a children's emergency room, but also more broadly, one thing that I've learned over time is there's always conflicting forces pulling on you. So, like the force to be faster, the force to make sure that you conserve resources, meaning don't prescribe unnecessary tests or antibiotics. The need to be with this patient, but the need to be with that patient. So, I find that when I get pulled in multiple directions, the first thing I have to do is think, what's the best thing for this patient or for these two patients? And really try to just take it back to the basics. Listening is an enormous part of medicine. And believe it or not, studies show that we interrupt people who are speaking to us in medicine, our patients, after 11 seconds on average. So sitting down and listening to what a person is really worried about, what they're really there for, is so important. Feelings matter. So I think previously or historically, medicine has been a pretty compartmentalized sort of enterprise. In other words, you're not supposed to cry at work. You're not supposed to feel sad after something um, serious happens at work or breaking serious news to a family. But really, of course, you have feelings. You have feelings all day long, and you may choose not to process them in the exact moment, but you will need to come back to them later and you need to pay attention to them. Um, so clear instruction and education, talking to patients about exactly what to expect next. Should they take the Tylenol? Should they take the ibuprofen? How much should it be? How often? Like those are actually really important questions that people will come back to the ER or call you for with questions. So just to be very clear up front. For kids, choices count. They're really scared when they come to the doctor. Most of them have had vaccinations already by the time they come to you. And giving them choices, even as simple as like, should I start with your left ear or your right ear, actually helps to put them at ease. Respecting people's privacy, creating a friendly environment, smiling at the people you see, greeting them, asking them how they're doing, making sure to include the whole family. So in pediatrics, mama's usually holding the baby and she's the one telling the story, and then dad's like sitting off in the corner, maybe feeling like not such a part of things. Engage that dad. Move your chair so that you're equidistant from them. Look at him, talk to them both. Make sure the whole family is involved. If grandma's there, talk to grandma. Um, Make sure to follow up. So I have a patient that I know I'm going to call after this because I saw them last night and I want to make sure that they're still doing okay. And to the extent that you can, be available. And that's all I have formally, but I'm happy to take any questions from the group.
All right, thank you so much. So, we have two questions so far. So, first question is, what is your favorite moment from your medical career?
Hmm. My favorite moment from my medical career is probably, wow, there's so many of them. That's
Mhm.
actually a hard question. There are probably small moments with my patients. I really like to sew lacerations. It's very meditative, and it's like you start with something that's broken and you actually fix it. And you can also really put someone at ease who's afraid that it's going to be painful. So, you can give them ibuprofen ahead of time and numb up the skin with some lidocaine, and then numb it up with lidocaine injections, and then get started so that doesn't hurt as much. So I think some of my favorite moments in peds have actually been sewing lacerations because you're just like in the quiet of the room and it's just you and the family and the patient quietly and you're just kind of quietly taking care of them. It's very peaceful. I think that's my favorite moment, even more than like the big dramatic ones, which are few and far between, but they're
Yeah.
there.
Okay. Okay, and the last question is, what advice do you have to current high school students interested in medicine but unsure of where to start?
Interested in medicine, but unsure of where to start.
Mhm.
Okay. So at some point, you've got to get your first break. And that's going to take kind of like relentless searching. Because again, it's so hard as a high school student to find like a shadowing or research position. Um, but try going through your various networks, like your family, your neighborhood, your religious community, and your school community. And if your parents work outside the home, their work community, see if you can find a doctor who's willing to take you on formally or informally, meaning like right there with them in their office or Zooming with them and helping them with their research. See if you can find somebody who you can spend time with and get a sense of what their career and their life and their work is really like. You need to be around it to know if it's going to be a good fit, but it's going to take a lot of searching.
Okay, thank you. And then one more question is, what was the deciding factor between doing pediatric emergency medicine versus general emergency medicine?
Mm. Well, I knew. So when you asked my favorite moments, actually, one of my favorite moments was when I knew I wanted to do pediatrics. I was a medical student and I walked onto the pediatrics ward on my first day, and I knew from the feel of it right away. The whole place was so child friendly. And the demeanor of all the people taking care of them was so attentive and so caring in a way that I hadn't seen, not to that extent, I hadn't seen yet in a hospital. And the more time I spent there, I realized these are the people who work really closely with children and families. And this is definitely my lane. I thought I would do general pediatrics for a long time. It actually wasn't until residency that I realized how much I liked the emergency room. Um, but I never thought about doing purely emergency medicine. So it's a little bit of a it can be a little confusing, but emergency medicine is a residency that you do right out of medical school, um, rather than um, rather than a fellowship if you take care of adults. So right after medical school, I would have had to go do an emergency medicine residency to do emergency medicine. And I chose pediatrics instead, because I knew I was a pediatrician. And from there, after that, I did an extra 3 years. That's just one of the like funny things about the field. You kind of have to know ahead of time you're going to want to do peds. There are some rare instances where you can do it the other way and go from emergency medicine into peds and then go work in the ER, but it's not as common.
All right, well, thank you again so much for your time. I think that is all for the questions. Thank you guys all who participated in the live session and those of you who are watching the video. And that is the November meeting.